Severe acute respiratory syndrome. Introduction. Severe acute respiratory syndrome, or SARS, was a contagious and potentially fatal respiratory illness. The respiratory illness known as SARS first appeared in China in November 2002, and scientists identified it in February 2003. SARS was the result of infection by a coronavirus that scientists named SARS-associated coronavirus, SARS-CoV-1. SARS-CoV-1 is related to SARS-CoV-2, the virus that causes COVID-19 infection. While COVID-19 is currently affecting people around the world, SARS was a relatively rare disease. At the end of the epidemic in June 2003, the incidence was 8,422 cases with a case fatality rate, CFR, of 11%. No cases of SARS-CoV-1 have been reported worldwide since 2004. Definition. Severe acute respiratory syndrome, SARS, is a viral respiratory illness caused by a coronavirus called SARS-associated coronavirus, SARS-CoV-1. Severe acute respiratory syndrome, SARS, is a viral respiratory disease of zoonotic origin caused by severe acute respiratory syndrome coronavirus, SARS-CoV or SARS-CoV-1. Severe acute respiratory syndrome, SARS, is a serious form of viral pneumonia caused by the SARS coronavirus. The virus that causes SARS was first identified in 2003. Cause. Agent. Coronavirus SARS-CoV causes SARS. A coronavirus is a common form of virus that typically leads to upper respiratory tract illnesses, including the common cold. Incubation period. The average incubation period for SARS is 4-6 days, although rarely it could be as short as 1 day or as long as 14 days. Reservoir. SARS-CoV is thought to be an animal virus from an as yet uncertain animal reservoir, perhaps bats, that spread to other animals, civet cats, and first infected humans in the Guangdong province of southern China in 2002. Human coronavirus types. Coronaviruses are named for the crown-like spikes on their surface. There are 4 main subgroupings of coronaviruses, known as alpha, beta, gamma, and delta. Human coronaviruses were first identified in the mid-1960s. The 7 coronaviruses that can infect people are: common human coronaviruses, 229E, alpha coronavirus, NL63, alpha coronavirus, OC43, beta coronavirus, HKU1, beta coronavirus. Other human coronaviruses. MERS-CoV, the beta coronavirus that causes Middle East Respiratory Syndrome, or MERS. SARS-CoV, the beta coronavirus that causes Severe Acute Respiratory Syndrome, or SARS. SARS-CoV-2, the novel coronavirus that causes coronavirus disease 2019, or COVID-19. People around the world commonly get infected with human coronaviruses 229E, NL63, OC43, and HKU1. Sometimes coronaviruses that infect animals can evolve and make people sick and become a new human coronavirus. 3 recent examples of this are SARS-CoV, MERS-CoV, SARS-CoV-2, COVID-16. Transmission. Experts believe that coronaviruses, such as SARS-CoV, spread through close human contact and in droplets from coughing, speaking, and sneezing. The body likely absorbs the respiratory droplets through the mucous membranes of the mouth, nose, and eyes. Ways of transmitting the virus may include hugging and kissing, sharing utensils for eating and drinking, speaking to others within a distance of 3 feet, touching someone directly. If droplets from one person land on an object such as a door handle or a telephone, someone else can pick up the virus if they touched these items. In 2015, scientists found evidence that SARS-CoV might survive on a dry surface for extended periods, possibly for several months. Sign and symptoms. SARS produces flu-like symptoms and may include fever over 100.4 degree F, 38 degrees Celsius, dry cough, sore throat, problems breathing, including shortness of breath, headache, body aches, loss of appetite, malaise, night sweats and chills, confusion, rash, diarrhea. The only symptom common to all patients appears to be a fever above 38 degrees Celsius, 100 degrees Fahrenheit. SARS may eventually lead to shortness of breath and pneumonia, either direct viral pneumonia or secondary bacterial pneumonia. Diagnosis: history taking, history of contact, sexual or casual, with someone with a diagnosis of SARS within the last 10 days or history of travel to any of the regions identified by the health authorities as areas with recent local transmission of SARS. Physical examination: listening to the chest with a stethoscope, auscultation, reveals abnormal breath sounds, such as crackles, which may be signs of fluid in the lungs. Often, blood pressure is low. Cyanosis, blue skin, lips, and nails caused by lack of oxygen to the tissues, is often seen. Clinical criteria of SARS-CoV diagnosis: early illness, equal to or more than 2 of the following: chills, rigors, myalgia, diarrhea, sore throat, self-reported or observed. Mild to moderate illness, temperature of 38 degrees Celsius, 100 degrees Fahrenheit, or higher indications of lower respiratory tract infection, cough, dyspnea. Severe illness, greater than or equal to 1 of radiographic evidence, presence of ARDS, autopsy findings in late patients. For a case to be considered probable, a chest X-ray must be indicative for atypical pneumonia or acute respiratory distress syndrome. Chest X-ray: a chest X-ray showing increased opacity in both lungs, indicative of pneumonia, in a patient with SARS. The appearance of SARS-CoV in chest X-rays is not always uniform but generally appears as an abnormality with patchy infiltrates, e.g. ground glass opacities, patchy consolidations unilateral. Complete blood count: white blood cells and platelet, clotting cell, counts in the blood are usually decreased. ELISA and PCR. SARS-CoV is detected using enzyme-linked immunoassays, EIA, or reverse transcriptase polymerase chain reaction, PCR, tests, which are available through the CDC. These tests are performed on respiratory secretions or blood. Medical management. SARS is a viral disease. Antibiotics do not have direct effect but may be used against bacterial secondary infection. Treatment of SARS is mainly supportive with antipyretics, supplemental oxygen and mechanical ventilation as needed. There is currently no proven antiviral therapy. Tested substances include ribavirin, lopinavir, ritonavir, type I interferon, that have thus far shown no conclusive contribution to the disease's cause. Administration of corticosteroids is recommended by the British Thoracic Society, British Infection Society, Health Protection Agency in patients with severe disease and O2 saturation of 90%. People with SARS-CoV must be isolated, preferably in negative pressure rooms, with complete barrier nursing precautions taken for any necessary contact with these patients, to limit the chances of medical personnel becoming infected. In certain cases, natural ventilation by opening doors and windows is documented to help decreasing indoor concentration of virus particles. Some of the more serious damage caused by SARS may be due to the body's own immune system reacting in what is known as cytokine storm. As of 2020, there is no cure or protective vaccine for SARS that has been shown to be both safe and effective in humans. Nursing management. Ineffective breathing pattern related to decreased lung compliance, decreased energy as characterized by dyspnea, abnormal ABGs, cyanosis and use of accessory muscles. Impaired gas exchange related to diffusion defect as characterized by hypoxia, restlessness, irritability and fear of suffocation, hypercapnia, tachycardia and cyanosis. Risk for decreased cardiac output related to positive pressure ventilation. Ineffective protection related to positive pressure ventilation, decreased pulmonary compliance and increased secretions as characterized by crepitus, altered chest excursion, abnormal ABGs and restlessness. impaired physical mobility related to monitoring devices, mechanical ventilation and medications as characterized by imposed restrictions of movement, decreased muscle strength and limited range of motion. Risk for impaired skin integrity related to prolonged bed rest, prolonged intubation and immobility. Knowledge deficit related to health condition, treatment modalities and hospitalization as characterized by increased frequency of questions posed by patient. Prevention. There is no vaccine for SARS. Clinical isolation and quarantine remain the most effective means to prevent the spread of SARS. Other preventive measures include hand washing with soap and water, or use of alcohol-based hand sanitizer. Disinfection of surfaces of fomites to remove viruses. Avoiding contact with bodily fluids. Washing the personal items of someone with SARS in hot, soapy water, eating utensils, dishes, bedding, etc. Keeping children with symptoms home from school. Simple hygiene measures. Isolating oneself as much as possible to minimize the chances of transmission of the virus. Wearing N95 masks could reduce the chances of getting sick up to 80% compared to no mask. A screening process was also put in place at airports to monitor air travel to and from affected countries.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.